Glaucoma is a condition that the doctors at Ko'z Nuri Clinic encounter almost every day. And unfortunately, in most cases, patients come in only when the disease has already progressed quite far. Not because people are irresponsible, but because glaucoma can remain hidden for a long time and show no obvious signs. This disease develops slowly, over years, sometimes even decades. It is not accompanied by sharp pain, does not always cause redness of the eyes, and very often does not affect central vision in the early stages. A person continues to read, drive a car, work at a computer, and sincerely believes that their vision is fine. Meanwhile, the optic nerve is gradually being damaged. That is exactly why glaucoma is called the silent thief of sight. It doesn't frighten you right away. It doesn't warn you. It simply takes vision away, step by step. It is very important to understand one key point. Glaucoma is not just elevated eye pressure. This is a common misconception. In reality, glaucoma is a chronic disease in which the optic nerve is affected, and the optic nerve is the main pathway that carries visual information from the eye to the brain. If this nerve is damaged, it cannot be restored. Modern medicine cannot regrow the optic nerve. So everything we can and must do is protect and preserve it. Inside the eye, a special fluid is constantly produced. It is essential for nourishing the eye and maintaining its normal function. Under normal conditions, this fluid circulates freely and drains out properly. But in glaucoma, the drainage mechanism is disrupted. The fluid begins to accumulate, intraocular pressure rises, and gradually puts pressure on the optic nerve. Under this pressure, nerve fibers begin to die. It is also important to know that glaucoma can develop even when eye pressure is not high. There is what is known as normal tension glaucoma. That is why relying only on pressure numbers is a dangerous mistake. At Ko'z Nuri, we always emphasize, diagnosing glaucoma requires a comprehensive approach, not a single measurement. So how exactly does a person lose vision with glaucoma? It happens in a very insidious way. First, peripheral vision is affected. A person may not notice that they have started seeing worse to the sides. They continue to see straight ahead, read, use their phone. But gradually, the visual field begins to narrow. A tunnel vision effect appears when a person can see only what is directly in front of them. Central vision, as a rule, suffers only in later stages when the disease has progressed significantly. That is why many patients say, "I don't understand when it started." And that is absolutely true. Our brain compensates for the loss of sight vision for a long time, and a person adapts without realizing that they are already missing part of the world. Sometimes glaucoma does give warning signs. Some people experience a feeling of heaviness or pressure in the eyes. Headaches may occur, especially in the forehead and temple area. Sometimes patients notice rainbow-colored halos around light sources or temporary blurring of vision, most often in the evening. But we must be honest. For a significant number of people, glaucoma develops for a long time with no noticeable symptoms at all. That is what makes it especially dangerous. There are certain risk groups. First of all, people over 40. Also, those who have relatives with glaucoma. The risk is higher in patients with diabetes, vascular diseases, and high degrees of myopia. Extra attention is also needed for those who take hormonal medications for a long time. If you recognize yourself in even one of these points, regular eye checkups are especially important for you. At Ko'z Nuri Clinic, we always tell patients one simple but very important phrase. Glaucoma is not a verdict if it is detected in time. Modern ophthalmology has every opportunity to slow down or completely stop the progression of the disease. We can reduce intraocular pressure, protect the optic nerve, and preserve vision for many years. But we cannot bring back what has already been lost. That is why early diagnosis is the key. After the age of 40, an eye check should include more than just a chart with letters. Measuring intraocular pressure, examining the optic nerve, assessing the visual field, and, if necessary, additional modern tests are essential. This comprehensive approach is exactly what we use at Ko'z Nuri Clinic. Our goal is not only to make a diagnosis, but to detect the problem at the earliest stage, when vision can still be saved. If you are watching this video now and realize that you haven't checked your eye pressure in a long time, or have never had your optic nerve examined, that is a serious reason to think about it. Perhaps you already have questions. Perhaps you have noticed eye fatigue, headaches, a feeling of pressure, or brief episodes of fogginess in front of your eyes. Write in the comments what exactly is bothering you, or what you would like to clarify about glaucoma, even if the question seems simple or insignificant. At Ko'z Nuri, we carefully read the comments and suggest what you should pay attention to and which examinations may be necessary specifically in your case. And if you want an accurate and professional assessment of your eye health, we invite you to Ko'z Nuri Clinic. Here, you can undergo a full glaucoma evaluation, receive a detailed explanation of the results, and get recommendations aimed at preserving your vision. Don't put off your checkup. Glaucoma doesn't hurt, but it takes away sight. Vision cannot be restored, but it can be preserved.